everyone, this is Shami Vadud, a cancer survivor, and today we have Dr. Meenakshi Sundaram, obstetrician gynecologist, Apollo Hospitals, Chennai, India, to discuss the gynecological cancer. So without further ado, let's dive into the discussion. Dr. Meenakshi, welcome to Doctor Story. My first question to you, in the current generation, we are hearing more about gynecological cancers. What are your thoughts about it?
Yeah, I think gynecological cancers is probably the second most cause of death in women. It is important to screen early. I think the commonest of the gynec cancers is the breast cancer. And after that, it is the cervical cancer, and then the ovarian cancer, and then uterine cancer. So whatever is the cancer, I think the most important thing is screening has to be done early. Follow-up has to be done regularly. By screening, there are a lot of tests that is available for each cancers to pick up the cancer issues right from the early phase itself. And then once they are detected early, then the treatment is also easier, the options are more. And also, if you look at the survival rate, it is much higher when the cancers are treated at a much earlier stage.
And why it is like that? Like why people get it?
Yeah, see, there are many factors that are, responsible for cancers. It is just not one. There is also a lot of genetic background to it, especially when you consider the breast cancer, ovarian cancer, uterine cancer. There can be some genetic links. The second thing is a lot of lifestyle modifications, lifestyle changes that have happened now. These can also be responsible. People have higher incidence of diabetes, hypertension, there is smoking, alcoholism. All these are some of the precursors for some of these gynec cancers. So a component of genetic plus a little bit of environmental and a lot of lifestyle changes are responsible for these cancers.
So does it usually come to the young population?
Yes, see, because now what is happening is the screening happens much earlier. The awareness is quite huge. So we find that even in the younger age group, some of these cancers are picked up very early so that the treatment is quite very good and their longevity or lifespan is much more increased and their survival rate is more. Most of these cancers, though they occur in a little, later age group like 40 to 60 years, we do see that many of the cancers now affect a much younger age group. You see patients even with 25 years, 30 years coming up with these cancer issues. And I think it's mainly because of the screening. And sometimes if there is a strong family history, we do tell the patients or the relatives to get screened early. And these can be picked up at a much earlier date for management.
So does food habit plays any role into it?
Yeah, I think definitely. Like I said, a lot of lifestyle modifications. Now, I told you that certain things like diabetes, hypertension are all precursors. So, obviously, anything that can lead to these diseases can also be, a predisposing factor for cancer. Main thing is, a lot of junk food also these days are quite prominent. So, you don't eat the right kind of fat and all. When you have a lot of vegetables, a lot of fruits and nuts and the right amount of carbs and fat, then the chances that you would get these cancers can be definitely minimized because these boost the body's immune system and they increase the antioxidant levels in your body, and these can in turn prevent you from getting the cancer, or you'll be able to fight the cancer better when you are on a good diet like this.
What are the latest treatments available for these such cancers?
So it depends on, if you look at gynec cancers, we are looking at ovarian cancer, cervical cancer, and uterine cancer and breast cancer. Now, when it is detected early, suppose when, let us say, an ovarian cancer or cervical cancer is detected early, it can be treated with surgical modality. So we can completely remove the cancer. So it depends on which organ is affected. But if it is detected at a little later date, then you have options for shrinking these cancers through chemotherapeutic agents. And probably after that, surgery can be advised. And some of these also may require additional radiation treatment. So it totally depends on what kind of cancer, at what stage it is detected. So there are a lot of treatments available. There is surgery, there is chemotherapy, there is radiotherapy, and there are also some advanced techniques which are called the HIPEC and PIPEC. These are intraperitoneal chemotherapies which definitely improve the survival rate amongst these patients and give them a much more longer trouble-free life.
Due to COVID-19, there is a delay of the treatment, and how to manage that if somebody is diagnosed with such kind of cancer?
Right. The entire world is now facing this crisis of COVID. So it's not, somebody alone. It's the entire world which is battling with it. And I agree that many times the cancer patients who are waiting for surgery or who are waiting for chemotherapy or radiation are a little getting affected. But I guess in most of the states in India, there are provisions to deal with these patients at, if the treatment is required at this point of time, then definitely they can go to the hospitals. The hospitals work 24/7. There are doctors working 24/7. So if you're in the middle of a chemotherapy cycle or you're in the middle of a radiotherapy cycle, you can still go and complete that. If you have not yet started and your doctor feels that it is okay to wait for a week or two before you start these treatments, then you can go by it. Now, as far as surgery is concerned, if it is a very early detected cancer and if the doctor suggests that you can maybe wait for 4 weeks to 6 weeks for getting the surgery done, then you go by it. Or if it is an emergency, like if there is an obstruction or if there is a, great swelling in the abdomen or there is some fluid collection, so any of these things, or if there is profuse bleeding, all these are emergency situations. So in these cases, I don't think there's any need to wait. I think the hospitals are well equipped to treat these patients, and a lot of precautions are being taken both for the patient and for the doctor in these crisis situations. You can consult your doctor and go ahead. Now, the other thing is a lot of follow-up patients, because a lot of them also keep getting anxious and worried that they are not able to do a routine follow-up. Now, a lot of these online systems and online appointments have made these also comfortable for these patients. So they can consult with their doctor online. They can digitalize all their reports, so they don't have to physically carry them even if they have to go to the hospital, because all these will reduce the possibility of getting a COVID infection. So digitalize your report, send it to your doctor either by a WhatsApp or an online consultation. And once you have all your reports, seen by the doctor, it's easier to consult, so that the meeting time is also reduced and it can be more productive. So the doctor would be able to tell you if they feel it is important that you need to come and see or come and do an investigation, then you can go ahead and do it. Or if it is okay and you can just wait for another 3-4 weeks to get your test done or a follow-up done, then you can do that accordingly.
So what is
So
the usual treatment? What
Yeah.
is the usual time of the treatment, if not COVID-19?
Yeah, if it is not COVID-19, then definitely the minute a cancer is diagnosed, then you meet a doctor and then you come at the diagnosis. So generally a biopsy is done, or some investigations like a CT scan or MRI is done, and some tumor markers are done which will pick up this cancer. Once a cancer is picked up, then it depends on the stage of the disease. So if it's going to be an early stage cancer, then most of them can be treated surgically. If it's a late stage cancer, then we have to look at options of chemotherapy and radiation. This also varies with the type of cancer. So if we look at, let's say, a cervical cancer. So cervical cancer, because of the excellent screening procedures that we have now, most of them are picked up very early. So when it's an early cervical cancer, then these can be treated by surgery. So the surgery would include like removal of the uterus with ovaries and the lymph nodes, and there will be an extensive surgery which removes whatever is involved. So this is all part of early stage cervical cancer. But at the same thing in cervical cancer, if it is late stage or detected at a later stage, then probably the patient may have to go in for a chemotherapy and a radiation as a primary modality of treatment, which will also give very good results. Now, when it comes to ovarian and uterine cancer, surgery is mainstay treatment, like especially in ovarian cancers, once it is detected by way of whether a CT scan or an MRI or blood investigations or tumor markers that suggest that a particular ovarian lesion could be malignant, then surgery is opted. So before surgery, a biopsy is done to confirm what is the type of cancer and how much has it spread in any of the other organs. And then the doctor generally, the surgeon generally go ahead with surgery, removes everything, sends it for biopsy. And post this, chemotherapy cycles are required in ovarian cancer. So once ovarian cancer is confirmed on biopsy, probably 6 cycles of chemotherapy is what generally is advised. So these go immediately, probably after surgery started within 2 weeks of surgery. And then between 2 chemotherapy cycles is generally a gap of 4 weeks. And if it comes to uterine cancers, generally when patients present with bleeding issues, and then we do an ultrasound, we look for the thickness or the lining of the uterus, and then a biopsy is taken from that. Once that biopsy confirms a uterine cancer, the general mainstay treatment for uterine cancer is surgery. So they have to have removal of the uterus with ovaries and all the lymph nodes associated with this. And once again, this goes for a complete biopsy after the surgery, the stage of the disease is seen. So if it's a very early stage, this much of surgery is curative. I mean, it is sufficient. If it's an advanced stage, then in addition to the surgery, probably chemotherapy or radiation has to be added to complete the treatment.
Would you like to share a few tips for our audience to avoid getting such a deadly disease?
Yeah, I think basically good lifestyle, healthy habits in terms of exercise, which also modulates in immunity to a greater level. Eating a lot of vegetables and fruits and nuts and the right kind of diet, especially at the right time. So these are lifestyle modifications that can help in avoiding most of these cancers. Obviously, avoid smoking and alcoholism as well. Now, as far as genetic, if there is some genetic component already to the cancer, and if there is a strong family history, then early checkup and screening is mandatory. So you can go for regular health checks and pick up if there are any lesions early. This will help you to treat the cancer much early so that the survival rate is much better.
Thank you very much, Dr. Meenakshi Sundaram, for joining us today. It has been an extremely productive and informative discussion with you. Dear audience, thanks a lot for being with us. Please stay tuned to Dr. Story for more productive discussion and feel free to ask any questions. We would love to hear you out and get you the answer to feed your curiosity. Have a great day ahead. Stay home, stay safe. See you around. Bye.
Thank you, Shami.
Thank you, Meenakshi.